Hi, I'm Matt Ellefson, and welcome to Fearless Friday. Today we are honored to have Dr. Julia Elvin with us, and Dr. Elvin is Vice President and Senior Associate Medical Director at Foundation Medicine. If a person does have a recurrence, he's been on, or he or she has been on several lines of therapy, they've changed medications, and now they have another recurrence. What is unique about, and why is it important to have another comprehensive genomic sequencing test performed on that biopsy? The patient may have already had two of them performed. Why now, at this point in time, with their recurrence, why is it important to get that biopsy sample and have it sequenced again?
So I'm amazed by almost how clever cancer cells are at surviving. I mean, these cells have a drive to survive within us. And when we throw different treatments at the tumor cells, it selects it puts pressure on the cells that have slight changes that make that therapy less effective to kill those particular cells. And those are the ones that stick around and recur or grow back or grow someplace else. And so there are certain kinds of therapy that provide what we call cytotoxic or general killing of the tumor cells, just fast-growing cells in general. And then there are newer therapies, these targeted therapies for personalized medicine that are trying to take advantage of the Achilles heel of that particular tumor in a particular patient. And so this is where the intersection of understanding the drivers of the cancer at the molecular level, and in patients like yourself and some patients with ovarian cancer, drugs are used specifically to try to affect that vulnerability. If there are cells that escape or evolve, right? So they're trying very hard to survive the therapy, and they grow back. If we test the recurrence after the targeted therapy, we can identify the new mutations that allowed those particular cells to survive the targeted therapy.
From a layman's standpoint and a patient standpoint, I like to explain it as it's more of a chess game. It's more of it isn't as much of a cancer treatment as it is a cancer treatment strategy, because you do have to really understand what is happening at your body at that particular day and time, because it changes over time. As you gracefully explained, the tumors develop resistance. And for example, with me with lung cancer, I was on a targeted therapy for the ALK gene, the ALK rearrangement, they call it. And I developed resistance to that first line of targeted therapy. And I had to pick, what is my next drug going to be? And depending on what that resistance mechanism was, I had three options. Mm-hmm. And then there's even a fourth option in clinical trial that would cover all of the resistance mechanisms. So some doctors may go to that clinical trial right away to be safe, but I wouldn't ever even consider that, because I want to buy as much time as I can and allow more drugs to be developed. So I'm going to jump to the next option, and I can keep that, that umbrella therapy that covers all of the resistance mechanisms in my back pocket for later. So that's a strategy that we use. And there is no way ever knowing how to make the right move in that strategy unless you have another comprehensive genomic sequencing test and really understand at a molecular level what is happening to you today. Not what happened to you 2 years ago when you were first diagnosed, but what is going on in your body at this moment in time. And is that a good explanation, do you think, of how things operate from, from somebody living with a disease that's not a medical professional?
Absolutely. I think the concept of playing chess with your tumor is absolutely right on. Depending on what the tumor makes as its opening move, you make your counter move, and then the tumor makes its next move. If you can't see what the next move is, how are you going to know what the most appropriate counter move is? Because absolutely, this is a chess game. And anybody who's played chess, we want to ideally checkmate the tumor. But if we can't checkmate the tumor, let's make the game last as long as possible and get it into a stalemate for as long as possible. And you can only do that by seeing the moves that the tumor is making and also having counter moves available to you. I think it's a brilliant way of describing the interaction between the observation, which is doing the diagnostic testing of the tumor itself, and then pairing it with the therapy as the move, and as needed, going back and forth between those two approaches.
Well, thank you so much. We know how busy you are, and thank you so much for taking the time to talk to us today. It's just been a wealth of information that so many patients out there need to hear, and survivors as well. So thank you for coming today.
Absolutely. Thank you very much for having me.
Survive It is an organization of survivors helping patients, survivors helping survivors, and caregivers helping caregivers, everybody helping each other. And if you have been affected by cancer in any way and have questions about any topic for any reason, please feel free to reach out to us at info@surviveit.org, because we are here to help. Until next time, I'm Matt Ellison. Stay strong and live fearless.